This video is intended to decode the dress code of how we are to present ourselves at Specialty Eye Care Group. Three basic premises of what we want to be is we want to look professional, we would like to look presentable, and we want the attire, the clothing, and the way that we look to be clean. Being in a medical field, we want to show our patients the utmost level of professionalism, and in most cases we want ourselves to be more professional in our attire than the way that our patients are, or at least at the same level as them. We want to be presentable in how we are so that it doesn't offend people, and we want the clothes that we wear and the appearance that we have to be clean. Note that the images that we're showing you are not exactly what needs to be wear, but they're just general ideas. So let's go through for men to start off with. In our practice, we take on a business professional, and what that means generally is some men will take that to mean professional with a suit and a tie. That could be dressed down a little bit with a vest, and on the most casual of ends would be with no tie at all. Generally, the doctors in our practice will be wearing a tie, will be wearing a sweater, and or will be wearing a suit jacket. And that would apply for doctors and interns. The other men in our office, if they work as a support team, the most casual of dress that we would like them to be would be at the level of just a shirt and slacks. So this would be relaxed casual. Note that there's no facial piercing. At our practice, we ask that there's no piercings except for a nose stud. Casual or dress slacks only, being dark colors, no jeans. And shoes must be clean and in good condition. Now you'll note here that he's wearing dress slacks that are professional in nature. They're not a khaki or a khaki type of material, but they are at the utmost of professionalism. This is a warm feeling. The hair must be combed in a professional manner, and as you can see, this guy just has his hair shaved, but it does need to be clean cut for the most part. No sweatshirts or hoodies, and again, dark colored shoes. Now this is more of a dress to impress. This may be a special occasion for our team. You may see the doctors wear this type of attire. If we're growing a beard, it needs to be groomed. No visible neck or arm tattoos. And black socks only, or dress socks. No white socks with black shoes. And moving over to the women's side of things, also a classic, professional, presentable, and clean look here. This is a relaxed casual. Again, hair needs to be clean and professional. Sleeveless tops are fine, but spaghetti straps that are thin are not. Pants or capri pants need to have a professional hem to them. Sweater, a lightweight cardigan with a dress pants is okay. Bulkier sweaters with pants is okay. And skirts must be no shorter than 2 inches above the knee. Again, we're trying to convey a professionalism. We don't want to make anybody feel uncomfortable. And at times in our office, we do have to get down and help patients, particularly if it's pediatrics, so we don't want to make anybody feel uncomfortable. Sandals can be worn, but they must include a back strap. Not flip-flop sandals. Those are not approved. If they are dress Sandals that are professional, have a back strap, those may be worn. Again, no facial piercings, and low cut shirts are not acceptable. So we certainly do not want to show any cleavage or anything. So we don't want anything low cut or loose that would again make people feel uncomfortable if you're having to bend over. And shirts must be tucked in, or if they're intended to be out, are a longer style. Again, no slippers. Shoes must be clean. So a couple of the don'ts is, for the most part, no unnatural colored hair. If there's a highlight or something, that may be okay, but for the most part, no, all pink or all blue hair. No jeans. Yoga pants are a no, and no white socks. If it's a form-fitting and tight pant, that's not acceptable because it doesn't follow the clean, professional, and presentable type of look. We're not against tattoos and we're not against piercings, but other than a nose stud, any types of tattoos need to be covered, and that just goes along with making people feel comfortable. And we realize we're perfectly comfortable as a team with them, but we just want to make sure that we're making sure all of our patients are comfortable. No worn out clothes, no tank tops, and no t-shirts. So what does worn out clothes mean is, does this garment look the same as it would had it been brand new? Some things that are okay, for instance, cardigans, things that are a little bit longer skirts. We want, again, no shorter than 2 inches above the knee. Leggings are allowed with a long skirt. We don't want to have a short skirt and leggings. And vests, blazers, boots, heels, and particularly if you're in the back, or you're in a more active role, we do allow kind of a sneaker type of shoe, but it needs to be very clean. So that would be a Converse or a Van style shoe, but it needs to be very clean with the white, meaning you probably need to clean it at least every week to make sure it's clean and acceptable. So make sure you think before you do, and dress to impress. If you have a question about something that you are wearing, it's probably a no.